Good afternoon, everyone. We will give it a few minutes before we get started. All right, hello everyone and good afternoon. It is right at 12, so I will wait 1 or 2 more minutes. I know people are logging on now. All right, we will go ahead and get started. Welcome. Good morning. Well, actually, it is afternoon now. Thank you so much for joining us for United Way of Greater Nashville's Virtual Tour Tuesday. My name is Heather Hill, and I am the Associate Director on United Way's Workplace Engagement Team, and I have the pleasure of presenting today's Tour Tuesday webinar. Now, Tour Tuesday, some of you may be familiar with it, but it's a great opportunity for anyone and everyone to get an inside look at the incredible work happening right here in our community through United Way's partner agencies. For fellow nonprofit staff, this is an informative way to learn about other service providers and programs that might be beneficial to your own clients. And for those of you looking to get involved, Tour Tuesdays can be a great way to hear about the current volunteer and engagement opportunities. And for our United Way donors, this is a fantastic opportunity to hear from the agencies who are putting your dollars to work in our community. Now, each tour features agencies and programs from across the greater Nashville area as we come together to discuss current community conditions. And today, we have a special treat for you. We will be highlighting our 211 helpline because 211 Day, it fell on the 11th of February. And during today's tour, we'll hear from Lakeelia Lovin, 211 Senior Manager at United Way. And at the end of the session, you all, the attendees, will have the opportunity to ask Lakeelia questions through our Q&A box. So if you would, just hang on to those fantastic questions until the very end. Lakeelia, welcome and thank you for joining.
Absolutely. Thank you guys for having me.
All right, so would you like to go on and get us started and just by giving us an overview of what 211 is and how vital the resource is to our community?
Absolutely. Let me go ahead and share my screen. Can everyone see that? Can you see that?
Yep, perfect.
Great. So thank you all for joining us today. I want to take the time out to say if there's anyone on the call who participated in 211 Day. I want to say thank you all. We had this great idea to ask everyone, to send our partner agencies a request out to say, send a shout out to 211 on 211 Day. And a lot of people participated. They basically just made a short video saying how vital 211 is, and they posted it on their social media platforms and tagged United Way in it. So if you all done that, I am so grateful for you for that. Also, if you've ever given out information about 211 to any of your clients, I'm grateful for you all for that. Just continue to spread the word. What gave me that idea to do that for 211 Day is a friend of mine reached out and said she was at an event and people were talking about resources, and there were so many people in the building who didn't know about 211. And so that gave me the idea for 211 Day to take that opportunity just to highlight it. I think someone from NASCAR did a shout out, the mayor did a shout out, a couple agencies, a few agencies did it. And so I'm just grateful for that. And so I'm going to go ahead and dive right into my presentation. And you guys, like you said, hold your questions for last, and I'll be willing to answer those. So my name is LaKelia Lovin again, and I'm the Senior Manager with United Way of Greater Nashville for their 211 program. So what is 211? It's a way to get connected to resources. It's free, it's 24/7. You can connect families and individuals to local resources that they may need. A couple of examples of things that people call and get resources for is food, rental assistance, utility assistance, employment services, counseling, shelters, free tax preparation, you name it, 211 can help you with that. I like to refer to 211 as a great place to start. It's a great place for individuals just to start when you're looking for help. So Tennessee, 211 is covered statewide for Tennessee. If you call 211 in any of the areas that are in white, or any of those counties, you're going to speak to our 211. You're going to speak to a specialist there who can assist you with help. Any of the areas in pink, you're going to speak to someone out of Knoxville who can help you there. Any of the areas in blue, you're going to speak to someone out of Chattanooga. Those little orange areas up there, I think that's Stewart, Montgomery, and Houston counties, you're going to speak to someone in Clarksville. The area in yellow is Memphis, and the area in green is United Way of West Tennessee. So as you can see, our state is covered for 211. So anywhere you are, you can call and get help. Couple ways to connect to 211 is you can call 211 from your phone. You can text your zip code to 898-211. You can chat with someone live, and you can also visit our online resource database. Our state works together in a way that our resource database is all together. So if you go in and you just search food, you're going to get resources from all areas: Memphis, Knoxville, Chattanooga, Nashville, and all of that. And so the way to do that, I like to tell people that it's not necessarily a Google search engine. And so the best way to do that is to narrow it down by an advanced search. So if I live in Rutherford County and I'm looking for resources in Rutherford County, I click on food, and then I go to advanced search, and then I will search for Rutherford County and resources in those areas. The next thing I want to talk about is what 2022 looked like as far as referrals. So we had just under 66,000 referrals that we gave out last year in 2022. Some of our top calls that people were calling about was housing and shelter, with rent assistance being the number one. We took just over 13,000, had just over 13,000 referrals for rent assistance. Next was that low income housing, rental housing. As we know, costs a lot to live in Nashville. We know that people are constantly looking for low-income housing. And then the other thing is homeless shelters. Next was utility assistance. We know in those winter months, those electricity bills can get up there. I think mine was quite a bit last month. And so we had just under 10,000 referrals for that. Water assistance was next, and then gas assistance after that. Food and meals, that's a big thing. You guys know with inflation, the rising prices of food. I think last month I spent $3 on a 6-pack of eggs. Everything is just going up. And so people are calling about those food pantries and asking where they can go and get that. Food stamps is another thing, and we'll kind of get into that later on in the presentation, but SNAP benefits is another thing that we offer when you call 211. After we're finished talking to you and giving you the resources that you asked for, we ask every caller if they're receiving SNAP benefits. And if they are not, we ask them if they would like to see if they qualify for SNAP benefits. And if they do, we do a short assessment. It's like 5 or 6 questions to see if you qualify for SNAP benefits benefits. And if you do, we refer you to DHS. And if not, we don't. But if you do, we refer you to DHS. And then we also do a follow-up call just to see if you were able to get connected. And if you weren't able to get connected to SNAP benefits, what were the barriers for that? So that's another one that we get a lot of calls about. Home delivered meals is something that came during COVID, started kind of trending after that. People were afraid to leave the house because of COVID. They didn't know what this thing was, and they were afraid to leave. And so they were calling 211 and asking, where do I get food delivered? Who does that for me or whatever? So that's another thing that's trending. Income support is our VITA programs. I don't know if you guys are familiar with VITA, but it is our it's voluntary income tax assistance program. It's basically volunteers who are trained by the IRS to complete your income taxes for free. I think if you make $70,000 or less, you can call 211 and tell them your zip code, and they will tell you a VITA location that's right next to you, and you can go and take your taxes there and get them completed. We like to advertise this service because a lot of times we have a lot of predatory lenders that will charge you a lot of money to do your taxes. And we want to make sure that you get all the money that you deserve, and you're able to put that money into your pocket and do whatever you need to do with it. Next is healthcare. Healthcare is big. Dental is a big thing. Community clinics are big. People want to know about community clinics because especially around the time when it's time to go back to school, people are trying to figure out where to get their kids' immunizations at. And so they're calling 211 to figure out where are the community clinics. COVID control, that number's kind of started to dwindle a little bit because people are starting to know exactly where to go to get vaccinated, exactly where to go to get testing and those kind of things. So those numbers have kind of died off. They were a little higher last year, but that is kind of coming down. So that's kind of an overview of 211. It's how to get connected, what 211 is, what it does, what our coverage area looks like, and what are the top numbers for last year. I'm going to stop sharing now. There we go.
Perfect. Thank you. Thank you so much. So you covered most of the reasons why, the issues that our neighbors are facing. How have you seen the needs change throughout your time with 211, and why do you think the changes are happening?
Absolutely. So one major change that I can think of is typically when I first started working for United Way and doing 211, we got calls from a specific demographic, and they lived in a specific zip code, and they were calling about specific things. I think once COVID happened, post-pandemic, we're getting a lot of people that I like to refer to as unusual suspects. So these are the people who aren't used to calling 211. They're not used to asking for help, and they don't necessarily know how to navigate this system. That in turn creates a whole nother issue because the system is not always the easiest to navigate. You may need to take a day off from work to go to this agency to get money to pay your rent, this agency you may have to go to several different agencies or whatever. I think it's very difficult because asking for help is hard. And if you've never had to do that, that's a whole nother world for you, whatever. And so that's one of the trending things that I've seen that's been different is getting calls from people who haven't normally been asking for help and now having to ask for help. We're trying to transition and get back into the workforce. COVID took a lot of people out of work. And so, like I said, there's people who are asking for help who've never asked for help before. Another way that 211 I feel like has changed is when I first started, I feel like a lot of the prescription drug crisis was kind of big around that time or whatever. We're getting a lot of calls about mental health services, addiction services for children or whatever. That's kind of dwindled off. Not saying that it's not happening, but it's not happening as much because basic needs is a really big need right now. Right. So those are some of the changes that I've seen over the time. Also wanted to say transportation used to be a really big issue. And I know that it's still an issue, but there was a time when our 211 was actually working with Lyft, partnering with Lyft to give people rides to work, to doctor's appointments and things like that. And so, like I said, I think the needs just over time change. And so we see what our needs are for Nashville and our area. 211s across the country, we do a thing called Big Count every year. And so all the 211s across the US and also in Canada will factor all their numbers in of what they're getting calls about. We just did this report last month, so I'm eager to see what's trending in other states and what the big needs are there, but we know what they are here as of right now.
Right. That would be interesting to see how, compare the differences regionally.
Mhm.
So what role, Lakeelia, does 211 play when in times of disaster?
Ooh, that's a good one. That's a good one. So we work closely with our VOAD, and we work also with our OEM, Office of Major Emergency Management. And so I will say that 211 has always played a role in disaster, but recently we've just really jumped into what helping out with disaster, and what kind of started that was the 2020 tornadoes that came in. March 3rd, the tornadoes hit, and our 211 is rather unique, I'll say, because um, we manage our resources here locally. So you have me and my resource specialists that work here in Nashville, and we're reaching out to all the agencies and we're getting all the information. But our calls are answered by Heart of Florida United Way. And some people may think, oh, wow, we speak to someone in Florida when we call. Yes, we do. But let me tell you the benefit of that. In 2020, when the tornadoes hit, our power at our office went out. But you know whose power was working? Part of Florida's. And so they were still able to connect people to vital resources whenever there was a total disaster going on. I think about Christmas Day when the bombing happened. Everybody was opening their Christmas gifts, and I was scrounging around for resources, trying to get them into the database. Everybody's power was out. You know whose power was working? Heart of Florida. And so Heart of Florida, when you think about Florida, you're like, oh, wow, they have hurricanes. What happens when the power goes out there? And I'm glad you asked that question, because they partner with Michigan 211. So when they don't have power, Michigan picks up their calls, they pick up our calls, and then they also have another entity that answers calls when Michigan can't help. So they have put in protocols and policies to help, even when they don't have power, when we don't have power. But I also wanted to say, working with our VOAD and also working with Office of Emergency Management has given us the opportunity to prepare for disaster. In 2020, disaster hit, and we didn't have a lot of time to prepare for what that looked like. So we ended up being reactive to a lot of the disasters that came to us. Like I said, we had the tornadoes, and then we had COVID, which was a disaster in itself. And then we also had the floods, the bombing, and all those things. I am so grateful for 2022 because there was not one disaster in sight, which gave us an opportunity to start working so that we can be proactive in case of a disaster next time. And so what happens is 211, everybody's written into the mayor's emergency management plan. They know what their role is during times of disasters. They know that 211 is going to be the call place for people to call to find out where the resources are. So all of our nonprofits have all gotten together. We talk about what happens next, how to get their resources to 211. I'm getting that information in the system, and we're getting this out as soon as we can to you guys, because we know that if disaster happens, we want to make sure that you guys have the resources that you need. I think in Tennessee, we think about specific disasters. So we think about tornadoes, we think about flooding, and maybe the occasional snow. But what 2022 did was it gave us an opportunity to plan for a bomb, because
Yeah.
nobody planned for that. Nobody thinks about a plane dropping downtown in the middle of downtown and what would happen next. And so 2020 gave us the opportunity to do that. And so that is what your 211 does. It is the go-to place when there is time in times of disaster.
That is truly interesting, to know that Florida takes those. I had no idea. So okay, so as soon as someone like you, because you've been doing this for a long time in this line of work, do you have any stories that you could share about what you've seen, impact how 211 has impacted someone's life or people's lives?
Yes, absolutely. Oh, I have two good stories. Oh, the first story that I have is a few years ago, I was doing a tabling event. Sometimes we do tabling events to go out and just kind of talk about 211. I was doing a tabling event at Cumberland University, which happens to be my alma mater, by the way. It was for Blue Cross Blue Shield. And I was doing a presentation. And as I was walking out the door, there was a lady that came to me and she said, hey, I just want to let you know that I appreciate the work that you all do. She said that her husband passed away on Christmas Eve. And she said on Christmas morning, she woke up and she said, I just hurt. She said it wasn't a physical pain, but I just felt bad. She said, and I didn't have anyone to call. She said, I just called 211. I don't know why. I just called 211. She said, and the call specialist stayed on the phone with her for over an hour. She basically said that the call specialist offered her resources and just told her about different support groups that she could join, and just kind of kept her on the phone and added and gave her a level of comfort. So on Christmas Day, to know that someone who has to work is pouring out and being compassionate to someone who in need, it just makes me feel good. It makes me know that we're on the right path and we're doing the right thing to help people. That is my first story. I have another story. And if you guys give me a minute, I'm going to pull it up because I typed it up and I sent it to my leadership team because I thought it was a really great story to share. So give me just a second.
You go right ahead. I love hearing impacts.
Oh, amazing, amazing. And it just, like I said, it just reaffirms that you're doing the right thing. You're on the right path with helping people. So
Absolutely.
here's my story, guys. Okay. So in early October of last year, I attended a 211 leadership conference. It consisted of 211 professionals across the country. And so one of the speakers, her name was Karen Littman. You guys can look Karen up. This is her story. She's currently a diversity and equity inclusion professional, and she shared her story. 17 years ago, Karen had been living in an abusive domestic relationship. She suffered from an addiction, and her addiction was as a result of her being physically and mentally and sexually abused. Finally, she found courage to leave with her two small children. A few months later, on what she described as the most horrible, terrible day, while sitting in her home with her two children who were dressed in coats because there wasn't any heat or food and she was behind on her rent, she decided to call 211. She described the phone as feeling as if it weighed 10,000 pounds. Making that call to her was hard. For her was hard. Making the call changed her life, though. Karen spoke with someone who was caring and compassionate and who listened to her story. She received referrals for SNAP, WIC, utility assistance, and support groups. She said it was a turning point for her. She never forgot this moment and the difference it made in her life. She went on to finish college, and she's now working on her PhD. Her two sons are now in the Navy, and they all give back by volunteering at the local United Way there. I share this story because this is what 211 does 1,000 times over. We meet people where they are, and we make it easy for them to share their stories, and we find, and we help them change their life. You guys, this story melted my heart. I could not unhear her talking about how heavy the phone felt of just calling and asking for help. Asking for help, as I said before, is not hard. Your fear of rejection, being frowned upon, and all these things. And so this phone call changed her life. The best part of this story, guys, is this call was taken 17 years ago. The call specialist that took the call was in the room. And they reunited, and that call specialist is now the director of that 211 in her state. And it was just there was not a dry eye in the room. It was just a really great story, and it just reminds us every day of why we do this work.
That is awesome. That is awesome. Okay, so I know when you set up one of your slides, you kind of showed different ways to connect with 211. Could you walk me through the process of me calling or saying someone wants a call needs rental assistance? How do they actually get the rent paid? Like what happens?
Absolutely. So when you call 211, again, you're going to speak to a live trained specialist. They're going to talk to you about your day. How's your day going? They're going to ask you about your need. And once you tell them what your need is, they're going to ask you for your zip code. And once you give them their zip code, now they're going to be locating those rental assistance places that are in your area. And so they're going to give you 3 resources. And a lot of times when people call 211, they don't always have a pen and paper handy, so they can text you those resources or they can email them to you. And so what that will consist of is the name of the agency, the location, a phone number, their hours, and some of the criteria. So it may be the reason why they're going to send you the criteria is because sometimes it may be only for single parents or only for parents with children and things like that. So they want to make sure that you're getting to the right resource. They're going to give you those 3 resources, and then it's up to you to give those people a call to see when you can set up an appointment to go by their agency to get your actual rent paid.
Okay. Okay. So should people tell their friends who live in the different areas about 211?
Absolutely. As I showed you before, we're covered as a state or whatever. So anywhere you are, you have family out in Knoxville, you can definitely tell them to call 211. If you have family down in Florida, they have 211s there. It's nationwide and also in Canada. I will say that there are rural areas that may not have coverage, but I guarantee you there is a place close by where they can find 211 resources, because we are working really hard to make sure that we have coverage across the entire country, even those rural areas. I'm from rural Kentucky, and so there are even areas there that, like, when I say rural, I mean population 800. So very rural Kentucky, but there is coverage there. And so we're working as a network to make sure that all the counties, even small rural areas like that, are covered.
Okay. Okay. Now, I know you mentioned this too, just briefly, but if someone's having like a mental health crisis, is 211 a good resource to start?
Absolutely. Our resource specialists are trained in suicide prevention. They're able to talk people down, and they're also able to do warm handoffs if they need to do that for mobile crisis or law enforcement. They are trained to do that. I always, like I said, I like to refer to 211 as a great starting point. And I think a lot of times, even in situations like that, people just don't know where to turn. 211 is a place where you can get the help that you need. Yes.
Okay. Okay. Good. Good. And then how, I don't know that you did mention this, but how is 211 funded?
Oh, that's a great question. So yes, it's funded solely by United Way, funds it for the most part. But there's also, I talked about SNAP benefits. And so SNAP, DHS does fund a piece of that with SNAP because we ask every caller if they're receiving SNAP benefits. And we get paid based off of how many people we ask. And like I said, we ask every caller. And then we also get paid on actually how many assessments we take and then follow up. So like I said, once we ask you if you're receiving SNAP benefits, we also ask you if you would like to get that assessment, and we conduct that assessment. And if you qualify, we ask you if we can call you in 30 days to follow up. And if we can, we want to figure out how we get, were you able to get connected? And if you weren't, what was the barrier that kept you from getting connected? And that information is then given to DHS, and we are reimbursed based on how many people we ask, how many people we screen, and how many people we follow up with.
Okay, good. Now, I know several agencies might be watching, so could you remind the agencies on how to upload information into 211 so that they can get it out to the specialist?
Absolutely. I'm going to share my screen because I'd love to show you guys our website just so you'll know how to do that. Let's see. Can you see that?
Yes.
Okay, so this is our website. And so if you go to our website, over here it has add agency. We have an inclusion and exclusion form. So typically we put nonprofit agencies in our database. There are some for-profit agencies in there, but you can go through and read that inclusion and exclusion form to see if you feel like your agency qualifies to be in 211. And if so, there is an editable PDF that you just download and you go through and fill this information out. And at the bottom of it, it has it down there. It has an email address where you can send it back to. So if you're in Middle Tennessee and you want to put your agency in the database, you fill out this form and you email it back to this email address here. If you're in Memphis, you use this address, and Knoxville, and then Chattanooga as well. So wherever you are, you can fill this information out. And also, if you want to update your information, you can do that as well. You can always contact me. I'll show my email address here in a minute, and you guys can always contact me if you have questions. I can help you get your information put in the system as well.
Perfect. Thank you. And then what can our listeners do? How can they get involved with 211?
So first things first, you can always go check our website to make sure that your information is up to date. I think that is a vital thing for you to do because the information that we give out to individuals is only as good as the information that you all provide us. And so make sure your information is up to date. We try to get that updated annually. But sometimes that doesn't always happen. I know there's a lot of changes. I tell you, somebody who's really good at that, Second Harvest Food Bank emails me every day. If there's a water leak or if they're closing early because of weather, they email me and say, hey, look, we're closing and you need to put that in 211. And so we update it live time, just like that. And so that's one thing you can do. You can always call 211 or email our 211 and let them know if you want to make changes as well. And then also just get the word out. Give your clients that information. Tell your clients, hey, call 211 if you need help. And also, if you know of agencies that aren't in the database that need to be in the database, just encourage them to join because that's going to send more traffic their way. There's a lot of need out here. And I know that there's a lot of resources that people just don't know about. I do have agencies that tell me, hey, could you put my information in the database? And then they get an influx of calls and they call back and say, hey, take it out, or narrow it down to specific counties or whatever. So we can do that as well. I just don't want people to have fear about putting their agency in the database because just because we put it in there doesn't mean we can't take it out. Doesn't mean we can't limit it by zip code or county or however it is that you guys want to do it. So that is a way that you all can help.
Fabulous. Fabulous. Thank you. Okay. So at this point, I know a lot of information has been shared and some of you might have questions that you would ask Lakeelia. So please feel free to submit it in the Q&A box at the bottom of your screen. And we'll just take a few the next few minutes to go through as many as we can. All right, I do have, while we're waiting for them to come in. So can people, oh, is it, they said the chat is disabled. Okay, I'll fix that.
Okay.
Okay, no, it did. It came up. I'm sorry. Okay, so can people call if they want to donate? Do you get calls for that?
Absolutely, we do. And so we used to do more of that where it was actually listed that people were taking specific donations. Like you have some people like Goodwill will say, oh, we take clothes during this hour. Or you'll have some, like the Help Center in Sumner County that'll say, hey, we do clothes and you can drop clothes off at this time. Sometimes agencies don't put that in there as much, but absolutely, there are opportunities for people to volunteer. There's also opportunities for people to donate. Absolutely.
Okay, so we have some coming in. So someone asked, does 211 have translators? And what should people do if they're in need but do not speak English?
Absolutely. So there are people on site who actually speak Spanish when you call in, and then the other languages are used. They have the language line. So absolutely, we speak there's multiple languages that can help individuals who call 211. And we mostly keep track with Spanish because we tend to get more Spanish Spanish speaking callers, but absolutely there is translation and anybody can call 211. Absolutely.
And is someone answering the phone 24/7?
Absolutely is 24/7, 365 days. And also, if you're texting your zip code to 211, somebody is live texting you back. If you're chatting, someone is live chatting you back. Yes.
How do you prefer to interface with County 911 and then 311 solutions?
Say it one more time. I apologize.
How do you prefer to interface with County 911 and then 311 solutions?
Think about that a little bit. Give me just a second. Interface with 911, 311. I think we just try to separate the two, like try to get that information out there. I think people are like 311, what is that? And everyone knows 911. And so I think just getting the word out there and letting people know, like 311 is for this, 211 is actually for this, and 911 is for this, or whatever. And just kind of saying that 211 is a kind of a non-emergency, but can handle emergencies, specifically crises and stuff like that. So I don't know if that really answered your question, but I think that's a differentiate.
That was a tricky one. I think it did. Okay, so would you suggest carrying 211 cards in your car to hand out, like when we see the homeless population that we see on the street?
Absolutely. I think, like I said, one of our top calls is for homeless shelters, food pantries and stuff like that. So absolutely being able to give somebody that, especially if you see someone out that's holding up a sign, just talking about hungry, because a lot of food pantries are not turning people away. They're giving out food.
Okay. Can you make VITA appointments through 211?
So we used to do that. We don't do that anymore because a lot of our sites are kind of walk-in, and if they take appointments, you need to call them specifically, but it just depends on the site. But you can call 211 to find out the closest VITA site to you and whether or not that site is taking appointments or how to connect to those appointments. So that information is in 211. 211 is just not scheduling the appointments at this time.
Okay. What is your greatest challenge?
Greatest challenge with 211 is keeping our research database up to date. I'm just being honest. I mean, there are thousands of resources in the database, and I know that all of the agencies are busy doing their work. And so trying to reach out to them, trying to get them to take time out to put their information in is just not always easy. Some of the things that we've kind of focused on as of late is basic needs, because that's what people are calling about. I would love to be able to venture out into more rural counties in Tennessee, to make sure that we have resources out there and that those resources are up to date. I remember specifically whenever the tornadoes hit back in 2020, some of the rural counties that got hit, we didn't have a lot of resources out there. So I was literally calling churches at that time saying, hey, look, who's helping people out there? So I could put that information in the database. And so that is a really big challenge. We are looking to bring in some interns to kind of help us do that here in the future. So if anybody on the call knows of someone anyone who's looking for just an intern, just to get some experience doing this kind of work, feel free to reach out to me, because that is something we're going to be doing in the near future, is bringing in some people to kind of help us get that database up to date.
Well, that kind of brings me to this next question. Somebody asked, do you need volunteer help? And if so, for what activities? Could that be something maybe a volunteer could do?
Absolutely. And you could do it in your free time. It's really simple. It would literally be you call an agency saying, hey, look, it's been a while since you updated your information. Is there anything changed? Are your hours still the same? You know, is your address still the same? Your phone numbers, all those things still the same. And it would just consist of you calling and emailing people to get that out there. So yes, thank you for that.
That is good. That's a good one. Okay. How long has 211 been around?
Ooh, you know what? That's a great one. And I don't want to mess that up. I don't want to mess that up, but I do know the answer, because, and I don't want to tell you wrong. I want to say, I think we just celebrated 25 years last year, but that's like nationwide. But for our 211 specifically, y'all got me. Oh, y'all got me on that one. But I'm gonna have the answer for you in just a minute. Give me a second. I don't want to give the wrong answer, so give me just a second. I'm gonna pull that up and get that out to you guys.
Okay, I'll ask you this. You can answer this while you're doing that. Is information distributed about 211? Is that distributed in school districts?
It is. It is actually. We encourage a lot of times. A lot of schools that will reach out to us and say, hey, can you guys come in and teach our school nurse how to navigate the website or whatever, in case we have we've had them do that in the past. Last year we did a whole presentation for school nurses on one database, online database. But in school, I know in Chattanooga, they actually have kiosks in their school that you can go in and type in what resources that you're looking for, and you can get that pulled up right there. We're not that fancy. We have a lot of schools in our district or whatever, but it is available for people. And anytime anyone on the call would like to get some brochures or anything like that sent to your agency, you just email me and I will drop them in the mail for you. We get a lot of people calling saying, hey, look, we need 211 brochures, flyers, rack cards, magnets, pins, whatever it is. Feel free to reach out to me and I can get those sent out to you.
Okay, good. Now, I know we talked about translators, but do the 211 reps, do we have reps that speak Spanish?
Yes. Mm-hmm. Yeah, they do. There are representatives that speak Spanish, absolutely. And then there are translators that for every other language. But yes, okay. On site, I want to say there are about 3 individuals who take calls who speak Spanish.
Okay. Mm-hmm. Okay, I have one more question. Mm-hmm. All right, let's see. Check to see if my agency is part of. Okay, thank you for your information on how to check to see if my agency is part of 211. I'm with the IRS Taxpayer Advocate Service. Look forward to receiving your contact information. Okay, absolutely. So that's a good comment. Yay.
Thank you so much. And I want to say that 211 started in Atlanta in 1997. And then we've had our 211 since 2004. And initially our calls were answered by Family and Children's Services. And then in 2015 is when it moved to Heart of Florida. I didn't want to give you guys the wrong numbers on the wrong dates on that. So thank you for bearing with me while I pull that up.
That is awesome. Thank you. So it has been around. Gosh, thank you so much. I think that was all the questions. And I know some of you may have further questions after today's presentation. Each attendee will receive a follow-up email with my contact as well as Lakilia's. So please feel free to follow up with us if you need more information. And again, thank you, Lakilia, for taking the time to be with us today. I know I speak for all of us in the virtual space that we are so grateful for the work that you've done and you continue to do. I also want to send a thank you to all the attendees who joined us today. Thank you for the time that you've devoted to our community today and for year-round support of United Way. This work could not happen without you. We hope that you will join us again for Tour Tuesday. Information for our next tour will be posted on United Way's events and meetings website page and sent to our mailing address. So again, thank you, and y'all have a great week.
Thanks for having me, guys.
Thanks, Lakilia.